Jabril is a 55-year-old married father of 3 who was diagnosed with type 2 diabetes within the last 6 months. His primary care physician has prescribed that he take metformin tablet 500 milligrams per day with the night meal, and that he monitor his blood glucose throughout the day while continuously improving his food choices. Now the blessed month of Ramadan is upon us, and Jabril is a little bit confused. Does he refrain from fasting because of his health condition, or does he potentially risk worsening his condition by fasting? Let's walk through this together. Fasting during the month of Ramadan is an obligation due upon every Muslim who has met the specified requirements, including reaching the age of puberty, being of sound mind and perception, not engaged in travel, and having overall good health. As it is stated in the Quran, the month of Ramadan is that wherein the Quran was sent as a guidance to mankind as clear proofs of guidance and the criterion. Let him among you who is present fast during that month, and whoever is ill or on a journey, then an equal number of other days. God desires ease for you, and he does not intend for you hardship. It is so that you may complete the number and magnify God for having guided you, that haply you may give thanks. Many of us know someone like Jabril. It could be a parent, a sibling, or a cousin who may be conflicted as to whether they should fast. They may insist on fasting while choosing to forgo an acceptable repayment, such as feeding a more needy person. To be a bit more specific, the following people are exempt from fasting from a health perspective: a woman who is pregnant or postpartum, nursing mothers, one who is of senior age whereby fasting may cause undue stress, harm, or even illness, one who is ill or has a chronic medical condition such in that they are required to take medication throughout the day by mouth. Dehydration may cause or can cause a life-threatening scenario. And some medical conditions that come to mind include diabetes, which is one of the biggest health prevalences in the Muslim community here in the United States. Also, sickle cell anemia, Parkinson's disease, thyroid disease, heart disease, hypertension, kidney disease, and even eating disorders. Research shows that patients such as Jabril often tend to alter their medication schedule, and sometimes they stop taking their medications altogether without consulting their healthcare provider. As a result, patients with diabetes can experience dehydration, hypoglycemia, hyperglycemia, diabetic ketoacidosis, and an overall worsening of their condition that might be irreversible. A study published a few years ago estimated that 90 million Muslims worldwide have diabetes, and in general, at least 80% of these patients with type 2 diabetes would insist on fasting during the month of Ramadan. In the same study, it is recommended that patients should check their blood glucose levels multiple times during the day and break their fast immediately if their blood glucose levels fall above or below a certain threshold. Other factors that need to be assessed for diabetic patients such as Jabril include asking, how has he been doing so far on his current treatment? Has his A1C and blood glucose levels been consistent or steadily declining over the last 6 months since his initial diagnosis? Has he been monitoring his levels consistently throughout the day? Also, what about social and environmental factors? Is he working a labor-intensive job, or does he have a high-stress career which can have negative effects on his health? Personally, does he have a support system that understands the importance of adhering to medication with a chronic illness? Does he have a family that can support him? Also, does Jabril exercise and eat for his health needs? Does he live in a climate that is hot, tepid, or cold? As these things can all influence one's ability to tolerate fasting, especially if they have a chronic medical condition. And then how many hours will he be fasting? Every patient is different, and this has to be taken into account early on. In general, if you have a chronic illness or know someone who has a chronic illness and which they are prescribed medication that is taken throughout the day, and they insist on fasting during Ramadan, talk to and work with their primary care team ahead of time. Do not alter your current treatment plans. Do not stop taking your medication without consulting your healthcare team first, and do not self-diagnose. In the case of Jabril, who is being treated for a diabetes diagnosis, he should work directly with his primary care physician, his nurse practitioner, a nutritionist, and even his pharmacist. They can guide Jabril with developing a plan on when to monitor his blood glucose levels, the best or better food choices he should make, and things to be aware of, including entering states of hypoglycemia and hyperglycemia. May Allah subhanahu wa ta'ala guide patients such as Jabril and you in developing a plan that will allow you to gain the rewards of Ramadan while staying as healthy as possible. Comment below if you found this topic insightful, as I think it has real impact for many fasting or wishing to fast during the month of Ramadan. And be sure to like this video so that it can reach others who might benefit. And please don't forget to subscribe for more balanced themed topics. May Allah subhanahu wa ta'ala accept our fast during this holy month of Ramadan. Thank you for watching and see you in the next video.